Shayan is a visionary and adaptable entrepreneur with a passion for leveraging technology to drive social innovation. His experience spans over 2 decades, during which he has demonstrated an exceptional ability to identify emerging trends and develop innovative products. Focusing on AI and machine learning for personalization in recent years, Shayan has successfully applied his expertise to a variety of industries, including health and education. Let's welcome Shayan. The stage is yours.
Hi, thank you very much for the kind introduction. I try to share a few lessons I have learned doing a few startups here. Great to meet everyone today. It's very impressive number of people join for this kind of talks. It's very really heartwarming. So as she introduced me, I'm Shayan. I have a title on my LinkedIn, which I think that's really who I am. I'm a CGO, Chief Glue Officer. All I do is finding the smartest people you can imagine, connect them together, and the rest happens magically. So that would be really my main function. Here I'm presenting Pingu, and it's about patient education, engagement, or overall experience. Studies shows that patients forget about 40 to 80% of conversation they had in a doctor visit. And 20% of readmissions to hospitals is due to lack of education about their medical condition, what they need to follow, what is really important to do after the discharge from hospital. So challenges of patient education is not personalized, is not necessarily accessible, by language and other means, is not integrated into the health process. It's not really engaging. Usually some materials, brochures or other videos, PDF is given to them. It's not cost effective, and it's very important. There is no evaluation. As a doctor, you might give your patient materials to read and understand, and then you never know, not only if they read it or not, if they understood it or not. So imagine to have a solution which is addressing those, and it is really integrated into daily life of users. It's not something they need to drop everything, go and do this and come back. I'm sure you all heard about ChatGPT and the new generative AI. For those of you who might not look into it deeply, we have been using AI in our daily life, right? If you don't get a lot of spam on your email, if you open your iPhone with your face recognition, Google Maps or credit card prevention, these all have been enabled by AI, but it's called narrow AI because it's been focused on one task, right? And now with the new wave of AI that became available to everyone, there are two aspects of it actually at the same time we are experiencing and we have access to. One is now we call it AGI versus narrow AI, which basically allows AI to understand, learn, and apply knowledge across a wide range of tasks and domains. And we can have this human, natural language interaction with it. And the other aspect of it is being generative, right? These two pictures are generated by AI, and you can, it's called prompt engineering. You can start training, fine-tuning, and ask AI to create something you want. So basically what we have done, which is available now to anyone with the background knowledge to do, is to combine different sources of information, being documents, videos, voice, databases, create a knowledge graph with it, and start this conversation with AI and ask questions. So of course, the elephant in the room, everyone talks about, oh, ChatGPT, it learns everything from internet, or it comes up with some suggestions, ideas in one word summary, AI hallucination, right? What do you do about it? And basically, there are two ways to work with AI. One is, we call it verified, which you use precise, that you use the verified sources of information. You can decide what information it should use to do the task you ask of it. And also you can control the zero of reasoning or creativity that you ask it to do. So with combining these two, you can stay at the direct short fact check slide answer when you interact with it, or you can give it more flexibility or full flexibility to just go and gather whatever you have learned from internet and do your best to come up with free reasoning and give us the answer. So of course, in our system, we have built for medical knowledge and patient interaction. We have focused on only verified information and zero reasoning. We have trained this AI. We have been working on it for some time. We needed to pick one area. We went to diabetes. The diabetes is huge, as you know, and we just stayed on diabetic food for now. We collected in consultation with diabetic doctors. We collected a set of documents that they usually give to their patients. Either if they have foot amputation or they are diabetes, they want to make sure they understand early signs of diabetic foot and all that, and give them an opportunity that they can interact with it. So in the same time, we did it. We did one version also that it is creative to compare the result, and we could easily see when we give it more freedom to reason or more information, it generates a longer answer, and when we go precise, it is shorter answer that it works. Let me give you a live demo here because nothing is like seeing it. So this is a live version. I come here, and in the precise model, we have some questions already suggested that patient can start typing what they have in mind, or they can just start with one of the suggested questions and get an answer about what they ask about. So what we have done, in addition to go back to this database of, or let's call it knowledge repository of the documents we provided, we also have developed this technology to find the most relative pictures and images related to the question asked. We can link it to different videos. In this use case, we just found the video on YouTube, but these videos can be pre-recorded video, internally verified, that we just point to those. And the interesting part is not just we search the title of the video to show, oh, this video is good. We looked into the content of the video, and if the content with all the audio to text technology, if that content is the best match to the question and answer and the question asked, then we suggest that. And also we have added another feature that, you know, the biggest issue in education is I don't know what I don't know. And when someone asks a question, we can suggest them what else you might know. Maybe patients are not really keen about smoking and impact of it, you know, on them and when they deal with diabetic food. So by seeing this, they can also learn about this and go and see it. But what is really important here, you can say, okay, now what is the novelty here? Now anyone can basically go learn how to work with this AI and build that. What we have built is, which is our IP, is we are creating a personalized knowledge profile for the user. From the question they ask, we know at what level user is, and what are they at, and basically asking basic facts. They know the basic fact, or asking more advanced questions, or they are at the level that they can apply their knowledge. And the next version we are giving, we had this technology already in the market, that we can also give a few flashcard style cards to the users, that they can also, after they do the interaction, they can read a card and they can say they think this phrase in the card is true or false. And based on that, we can also assess what the users said in a very highly accurate method. Again, from the question answer, we still can know that if users understood things or not, at what level they are they asking for more? But sometimes they might feel, oh, okay, I understood it all. They stop, they go a different direction. But with those card experience, we create the feedback loop. And also all users can give feedback about the answer. If they felt they need to learn more, we have that. But the card assessment is great. So on the other side, imagine we have the full provider report. When a patient comes to you or even remotely, you can see how many questions they have asked, what was the percentage of it. It was easy, medium, or difficult, at what level of knowledge. It was basic knowledge or more advanced question they asked. So as a provider, you have full access to that report. And when they come back even for next visit or before that, you can suggest them what else they need to do. So it gives you the full picture. So as you can see, we can be very precise in building this. We can have more creativity. What we have learned in the meantime is for providers, if we make them the more balance or creativity options, and they can benefit from it. It's not something we just give to patient because they don't have the knowledge to judge, but providers can do it. So just a few quick slides. Who cares? Of course, patients, imagine how much they can really do self-care, self-management. One thing which is very interesting is a stigma, right? We know a lot of people don't ask questions because they don't want to look, stupid or basic questions. So it helps them. And we know that how important it is, how many of questions that are directed at healthcare providers, we can, have users find the answers themselves. It can contribute to a star rating for reduced readmission and better patient satisfaction. Again, we wanted to start with an area, but we know that patients usually do a lot of research online, more than 30 or 40%. They ask questions online, the rest goes to their healthcare providers, and then the other areas from cancer, diabetes, depression, especially in depression and anxiety, mental health. Studies shows people ask more questions from a chatbot than their own therapist because they feel more, relaxed to share information. Market size is huge. Again, this is, we know about patient engagement. It's wide range from telehealth to other technology if you look at it, but only this area is huge. And our business model is we have B2C that people can go not for medical information, for general health and wellness. They use it, and we got more than 100,000 downloads as soon as we released the app to the market, just with the card experience and without adding the chat to it. But the interesting part is there are insurance codes available. It's actually we can claim when patients use it. If a doctor prescribes the app and technology, then insurance pays for it. And I just wanted to mention, historically in AI in healthcare, medical imaging has been the most successful one. Then personalized medicine, drug discovery, and AI-powered chatbot and visual assistant has been traditionally very successful. And we think with this technology, it will come up. Large language model have been introduced a few years ago. Recently, they got trained with all the huge investment big companies made, but LLMs are finding their ways into clinical use fast. We have built a great network of partners. We have already piloted our technology in a company that they use it for health and wellness for employees. And also now we are working with a chain of clinics. There are 8 clinics focused on diabetes for now. They want to use it, and we are going through a full validation process with them to show its efficiency and all that. So then we make it available to a larger market, but we are ready to collaboration, and our main ask is here for partnership. So we are bootstrap, self-invested. We haven't raised any funds, so we are thinking to start maybe our seed at a couple of $1 million. If you are also interested to look into our investment terms, we'll be glad to talk to you. Sorry, I went a bit above my 10 minutes.
No problem. Thank you so much, Shayan. And I just want to tell the audience that Shayan is doing this presentation and it's 3 o'clock in the morning. So kudos to Shayan for doing it this late.
No
But
problem.
excellent presentation. I can't emphasize how important patient education is. I mean, I see patients bouncing back to the hospital because they didn't understand why they were admitted the first time, or patient instructions from the physician are not clear. And it's hard. I mean, being in the hospital or even being in the doctor's office is a stressful environment. So mean, I can't believe that patients forget so much of what we tell them. So I think that this is really important. A couple questions that I had is, does it come in different languages, or is it only in English or Spanish?
Yes. Yes, actually, again, we released Pingu first with the card experience, and we used AI to make it available in 100 languages. So people can read the cards in their own native language, or they can launch it in English. If they are not sure about what a card says, they can see it in their own language. For those statements, not the chat paragraph, when we have those statements on the cards, AI is doing fairly a good job because the sentences are not long. So we tested it and it was reasonable. You know, sometimes it sounds funky, and you know how AI translates sometimes. And especially because they can see it in their own you know, language back and forth, so they can understand. For the chat experience, we are more cautious about it because it's more comprehensive and explaining. Technology is available. We haven't deployed it yet. But as you mentioned, you can adjust the answers based on literacy level. This is something we also do automatically based on question. You can, someone says, you know, CMS says it should be easily at 8th grade literacy level explanation. So we pre-apply all those, but again, it can be adjusted and very flexible, and it works very well.
Okay, that was my other question about the health literacy, because we want to make sure that
Yes.
patients understand what it's
Yes.
saying. Okay.
Yes.
And then physicians can also, do they also sign up for it? Because I know you said that this is patients use it and then the insurance will cover it, but then how does the physician use it?
Yes, because they're interested in seeing the reports and how patients are doing. They should. It is optional. If they want, they can have access to the information. Or they can just say introduce it to the patients to go and look at it, play with it, and try it, use it. But if they want to get report of patients, then yes, they should have an account with us, which we can integrate with any Epic or Athena or any other health system. We can do that. That's basically what we are looking actively with partners, health systems who are interested, or doctors, to see the interface. They are looking into it, so we can integrate it to give them access, especially before next visits, right? Imagine as a doctor, you know a lot more about where the patient is in their, you know, treatment plan and understanding or compliance with the instruction you gave them. We can, those card experience, we can also add, you know, a specific thing. Did you took your drugs on time? Did you did this and that? Yes and no, yes and no, yes and no. When they come, it can put the doctor in a much better position to understand where the patient is instead of spending time to gather all that information in the visits, right? So we can save a lot of time there.
I think it'll be interesting if you can show that the readmissions for hospitals decreases by having this patient education.
We have a partner that they have done that piece, and they have shown the proper education does that. The 20% comes from that. This partner, we are NDA, we will announce the partnership later, but they were even putting, you know, static data, like general, how to take care of your diabetic food if you are diagnosed by, you know, diagnosed with diabetes. But now we are doing the partnership to make this AI generated personalized content for their software. So yeah, studies shows that 20% is established fact. It's so we are tapping into that potential.
Okay,
We hope
great.
we decrease it even more.
Yeah, that would be wonderful.
Absolutely. If anyone is a doctor here or working with health systems, and again, it's not just about diabetic food. We are looking for different areas. For us, now that we have the engine and system, is very easy for us to apply it for different areas, and we will be very happy to do that. Just please feel free to reach out, and we will work with you.
Great. Thank you so much, Shayan.
Thank
Okay.
you.